Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. In the effort to stem youth use of vaping products, Health Canada announced its final Vaping Products Promotions Regulation last week, which set out measures to restrict the advertising and promotion of vaping products to youth. Central to the government's approach is a strict requirement to display health warnings on all vaping products promotions and point-of-sale materials. While overall the new regulations are welcomed by industry, it's becoming increasingly difficult for stakeholders to accept what may be considered as the original sin of the Tobacco and Vaping Products Act, the enshrinement of vaping as a health hazard, rather than a tool for harm reduction. The notion that vaping is a health hazard imbues the regulatory framework, and nowhere does one find a comparison of the potential health benefits of vaping to the known dangers of smoking. What is hazardous to health could never provide a health benefit, and so the argument goes. Joining us today on RegWatch is Sam Tam, president of the Canadian Vaping Association and tireless advocate for vaping. Sam, thanks for coming back on the show.
Brett, thanks for having me.
Well, thank you for coming on. So, Sam, we have a lot of details to get into today, and hopefully we can provide some answers and soothe a few nerves where needed. First off, though, for those who may be unfamiliar with the CVA, give us the lowdown.
The CVA's been, since its inception back in 2014, was created by the founders of the CVA were, retailers, people within the vape industry, small businesses. And during that time, when the industry was not regulated and government was looking to regulate the industry, these group of advocates felt that, they needed to set up an organization that would have the ability to communicate with government to ensure that we do have equitable and sensible regulations for the vape industry.
And how much of a challenge has that been gathering together the industry? Because that was really new. I mean, it'd only been a couple of years old.
I think it has been quite challenging. I think the most important part is, if we look at the history of the Canadian vape industry, most of the vape shops that have been open really started to open back in 2013. We saw an influx of a number of retailers that expanded their business over the years. But I think the most important thing is that we do remain united. And I think what we can expect from government now is the government expects us to unite the industry. When we do speak with Health Canada, one of the requirements that they've asked of us is to make sure that we do get the industry compliant and to work with all stakeholders that are involved to ensure that we do comply with regulations.
So walk us through what was released last week. These were advertising, promotions, and point-of-sale specific regulations, correct?
That's correct. Not only at the point-of-sales promotion, but it covers audio, visual, and I believe audio, visual, and video, right? So it covers all three aspects of it. So it includes also social media as well. So the Vaping Products Promotion Regulations covers in two parts. One's part one that covers advertising and sales, point of sales promotions, right? Anything within the store. And also part two covers audio, visual, and I guess, I'm trying to think there's a third one there, but pretty much anything in regards to broadcast media, that would be all covered under the regulation.
So let's cut to the issue that is obviously, instigated so much of this. Canada is in that unique position amongst countries that, Health Canada took a step to legalize vaping. The government did, working with Health Canada. There was really a stamp of approval that was put on vaping. This was pre-Juul and the big tobacco brands entering into the marketplace. So describe for us what kind of happened there in terms of your organization's overview of what happened to the Canadian marketplace around May 2018, just as, the TVPA, and for everybody, the Tobacco Vaping Products Act. So that's the act that actually covers and has made vaping legal in Canada. That became law May 2018. And then by September 2018, the wheels had come off.
Yeah, and I think we have to look at is during that time in 2018, new products were entered into the marketplace, right? And these products are relatively, in terms of nicotine concentration level, were extremely high, as high as, we can look at as high as 10 to 20 times more nicotine than the conventional products that were sold during that time in the marketplace. But not only that, but you have where you have in terms of the access of the channel, now from being products being available in 1,000 vape shops, now you have products now available in 20,000 stores across the nation. So one of the issues is now you've got a lot more access, an extremely high nicotine concentration level at places where young persons congregate, right? So I think one of the issues is that now you've got massive advertising that's being put out by tobacco companies, where we've seen a lot of the advertising that are in non-age restricted channels, right beside the gums and candy, that had really become a problem, right? So if we look at someone that's not doesn't have the recognition or knows what the product is getting exposed to understanding that now these products are in their face, right? So I think even look at the messaging, right? So when you have advertising messaging that says hits the spot, perfect puff, these aren't messages of harm reduction or messages that are trying to communicate with the smokers, right? So I think it's really important that we identify that, why there was tremendous youth uptake during start of 2018 and that we're experiencing now. And that's why we do support some of the restrictions that the government's put in place when it comes to advertising and promotion, and even national ban on advertising, right? So, we need to ensure that these products are continue to be marketed towards adult smokers in age-restricted environments, right? So, and I think it's unfortunate that some of the companies have taken full advantage of that, and now we are dealing with tougher regulations for the vape industry.
So we asked this question to everybody pretty much ever since the teen epidemic happened. We've been a bit skeptical on that, but there's no point banging your head against the wall on issues with when the government is moving in that direction and the public believes it is, and it could very well be. So, I mean, I don't know. CVA, though, has definitely, recognized there's a problem with youth.
Absolutely. And I think some of the recommendations that we put forward to government includes restricting advertising to adult-only channels, right? So age-restricted environments. And also, we've recommended a national ban on advertising, right? If we look at it, I mean, there's no reason why a vaping advertisement should be in a hockey rink or a billboard or even on national TV, right? So I think it's very important. Not only that, but we also further recommended the government to look at age verification when it comes to online sales, right? So some of the things that we've been doing is we had a board member that developed software in terms of age verification software that would stop a young person from purchasing the product, right? And this goes through Equifax when it comes to verification, so we don't have to deal with privacy law issues. And we've done that. We present that to the government. So we are trying to be a partner when it comes to dealing with youth uptake, and we've offered these solutions to Health Canada. And that's what we're seeing in today's regulations on the Vaping Products and Promotions Regulations that's being put forward.
So there is there's been quite a bit, obviously, of media coverage in Canada. I'm scrolling some global stuff. This is just Canada that was gathered right before we had our interview last spring with the Director General of the Tobacco Control Directorate, James Van Loon. And it's quite stunning, just the level of media coverage and how far one-sided it was. Being the CVA, you guys had to first, fight against this, and then you had EVALI come up after. Talk about the media environment for us and your experiences dealing with national media on these two issues, which roll into each other: vaping epidemic of youth vaping epidemic, and then the vaping-related lung illness.
Brett, it was quite busy 2019. I have to say that. We've been focusing a lot of our efforts on engaging the media, right? Changing the perception of vaping. And I think, we do recognize that there's an issue, right? We're not hiding from that. Youth vaping is an issue, and that's something that we've addressed this to Health Canada, that, we would do whatever it takes to deal with those issues and have solutions for them. And we've been talking about some of our recommendation solutions and being put forward. And we've been addressing that in front of media as well, right? And I think some of the challenges that we're facing is the media isn't taking the positive effects that vaping has done for a lot of former smokers, right? If we look at, going back to 2013, the smokers, those had the will to quit, really went into a vape shop and really present themselves and say, hey, how would I get started to quit smoking? If we fast forward today, I mean, we've converted, if not hundreds of thousands, a million vapors, that have quit smoking cigarettes. It's a big number, right? And we have to recognize that, right? And it's really important for us to not only educate the media, and I think we will eventually, because the science and the data will eventually support that. And we can look at a lot of that information from Europe. Europe has a lot of studies and data that's being presented, and we know there's regulations in Europe that addresses some of the concerns that public health is looking at. Right? What are the harmful effects of vaping, whether it's toxic or not. Regulations are in place in Europe to address that, and I think we're going to see that come in Canada. And I think some of the challenges is really changing that narrative, right, and focusing that we are going to be working with the government to ensure that we're part of the solution when it comes to dealing with youth uptake and how we're going to address that. But most important thing is we can't forget those adult smokers that have converted to vaping, right? And we have to recognize that it is a less harmful alternative to combustible tobacco.
And I mean, that definitely is the case. I'm going to just pop us over here to deep inside the Vaping Products Promotion Regulations that were just released last week. And you were mentioning a big number. There was another big number that I came across here, which was great to see. So they've got some overview on numbers here according to 2017. I wish those were a little bit sooner, but let me just, where exactly? Overview of the Canadian Vape overview. Here it is, right here. You know what? I can't find it right off the bat here. So what I've got for the numbers here, according to a 2019 market study, the vaping products market in Canada was estimated to be approximately $1.36 billion. That's last year. That is a big number, and not one yet that I've seen anybody be able to put to the industry. And I mean, what did you think when you saw that? I mean, did you just know that? Of course it's that big.
No, actually, I didn't. I don't think a lot of us knew that the vaping market was that large in Canada, and I think it's really interesting. We would like to see the data, but I think I mean that is something where I think for a long time we thought it was half of that, right? So it also shows that there have been a lot of people that have transitioned from smoking to vaping. Right. And I think we have to look at today's technology compared to the past. Technology today is extremely more effective and much more easier for smokers to convert. And there's no doubt, when it comes to access, right, 20,000 outlets, convenience stores, vape shops offering these products, there's no doubt there's people that are going to try the product. But I think one of the major concerns that the government has put forward is that the issue that the focus, what we have to deal with is how do we solve or deal with the youth uptake issue, which is the government's priority. And we've seen it not only at the federal level, but across all provinces that, dealing with youth uptake, addressing those issues is the priority of all governments and different levels of government.
So, okay, I'm going to get out a hard question, or I don't know if it's hard. It's more an observation. Feel free to bat it away, definitely if you can or want to. But that is, we've just gone through 4 months of total lockdown, and I've not heard any news that there's still, I mean, didn't the kids just get all washed out? I mean, shouldn't they have just all lost their vaping addiction because their parents have been watching them all day long and they've been locked in the house? Where have they been getting their supplies? Like, just the whole vaping epidemic thing seems to be carried mostly still on 2018 and 2019 data. And I'm wondering about public health going, why hasn't they been saying, this has been a great opportunity with COVID to get our kids off of nicotine? Instead, it's like almost a frozen epidemic. And I'm just wondering if anybody's thought about that the effect that COVID has had, like maybe it's washed some of this epidemic away.
Well, Brett, I think some of the major challenges that we're facing in the industry is, and we brought this to Health Canada as well, is that in Canada, surely we can control access and where the products are sold. But let's not forget we have open borders, right? So this doesn't stop, a young person from buying a prepaid credit card or getting access to a credit card and buying products internationally, right? So they can order from the U.S., they can order from China. There's no restrictions when it comes to that. And not only that, I mean, one of the key things that we've always asked the government to do is we have to look at how are we going to be able to close up the borders, right, and to screen all the products that are coming into the country. Because one of the major issues the industry has been working really hard on is being compliant to the Canadian regulations. So this covers not only labeling and packaging regulations, but marketing as well. And one of the challenges that that we face is that there's no restrictions or the border hasn't been put up, right? So anyone can bring in these products that are non-compliant, right? So as the Canadian industry is working really hard to comply with government regulations, we're also facing the black market, and we're also facing the illegal products coming into the country that we haven't really addressed, right? So that is something that we continue to push and present to government, that we have to really deal with that, right? How do we age restrict kids from buying products, internationally, right? And that is a major concern.
Fair enough. And well done, too. Good answer. So when it comes to these regulations, then, let's do this. I'd like to dive into some of the details, specifically what you may or may not find that work well. And some of it I know that you, CVA, advocated for, which is, I think, is really is a strong, is a very... I'm trying to figure out a way to compliment you guys in terms of being forward stepping on these regulations, because we've been covering this now for 5 years, alongside with your guys' efforts. And it's tough to move regulators, and it's hard when, the world's collapsing in with, what is international, media events going on, that, are life and death for some people. There's no doubt. We've got a interview with Rob Cunningham, who's the senior policy analyst at the Canadian Cancer Society. He did with Mike Smith here in Vancouver, CKNW Radio 980. And this was done on July 9th, so just last week, right after the regulations came out. And it's an interesting bit of sound that we've got. I've got about 2 minutes of that 15-minute piece, so let me just go to that right now.
Vaping now has been a big problem in our country and in our province for sure. I remember back when the schools were open there's a high school close to my house. If I ever walked my dog by there or whatever, one of the things you could always count on seeing was a group of kids surrounded in a vapor cloud. A lot of these kids were vaping. You'd even have kids vaping right in class in front of the teacher. This is what they used to call stealth vaping. Some of these vape pens are so small, you just tuck them into your pocket in your jeans and take a quick puff, even at any place, anytime. It's troubling. Now, check this out. New advertising restrictions brought in now by the federal government to prevent advertising from targeting young people to take up vaping. This Canadian government announced these regulations this week. It will now be prohibited to advertise vaping products in public spaces where they can be seen or heard by youth.
Thanks, Mike. Good to be with you.
What do you think of these advertising restrictions on vaping?
Well, we strongly support them. I guess that'd be no surprise. We are very, very concerned by this dramatic increase in youth vaping. Canada-wide, over a 4-year period for grade 10 to 12 students, it's increased from 9% to 29%, more than tripling. And now, why? There's a number of factors, but one of them is advertising. And in mid-2018, the tobacco companies entered the market once e-cigarettes with nicotine were actually legalized. Technically, they'd been illegal before. And they had these extensive advertising campaigns, which harken back to decades ago what they did for tobacco advertising. And while there are now some restrictions on the content of ads in terms of people and in terms of lifestyle advertising that's banned, there was federally, or in BC, there was no restrictions on the location of ads.
Right.
So there's ads on television, on radio, on billboards, on social media, in print publications, on the internet, all kinds of places, outside shopping malls. I think there's an issue with respect to the SkyTrain, so that's going to change with these regulations. And
That would all be banned now. All those ads would be banned now, right?
That's correct.
Yeah.
They can only be in places such as a vape shop where kids can't get into, potentially a bar or a casino, or if you can have some online ordering system where you can have some legitimate age verification. So it's going to be much more curtailed. We would have liked a total ban on everything except in vape shops. Even the Canadian Vaping Association would support that. But these regulations are a huge advance. They're going to protect kids, and we're supportive of what Health Minister Patty Hajdu has done.
So there you go. And that is one of the biggest critics of the vaping industry overall, providing you guys a bit of a shout out in terms of sharing some position on this issue. How important is that?
To be honest, Brett, I didn't really expect that, but I think it's important, right? Because we're on the same page when it comes to vaping products, in terms of harm reduction. I think the most important thing is going back to how this industry was really built was adult smokers looking for a less harmful alternative, and the vape shops provided that, right? And we were the gatekeepers, for
Okay, that sounds like pretty close to almost like a blanket ban on advertising on vaping. Although, so where would they be allowed to continue to advertise vaping products? Like you mentioned, it would have to be in somewhere that's age restricted, right? So like in a vape.
In such a huge access across the country is, we have to look at this way. It's hard for the government to control. How do you control 20,000 outlets that are now offering these products? And most important thing is the product that they're offering is extremely high nicotine, right? As we know, and we have many discussions in regards to flavors and nicotine strength. It's flavors is not what's addictive. It's nicotine that's addictive. And I think the most important thing is anything that's high concentration level needs to be restricted in where they should be sold, right? I can't imagine, back in the days when we look at a vape shop, someone that smokes 2-3 packs a day would go into a vape shop and say, hey, I smoke 2-3 packs a day. What nicotine strength do I need to start off with, right? And those users will most likely either use 12 milligrams, 18 milligrams, or maybe even 24 milligrams, whatever they need to get off of combustible tobacco. But now you have, nicotine strength, 3-4 times as much, as high as 59 milligrams of nicotine that's made available in across the country in more than 20,000 outlets. So now you've got a lot of access. I would say at that point where it's uncontrollable, that's being a problem, right? So I think the most important thing is restricting access would play an important part of reducing youth uptake, right? And I think that's something that it's not going to be instant, but we will know somewhere down the road as we see advertising being restricted, and we'll see the exposure to youth will be very limited, right? Any new products, they wouldn't be able to see it, and really focus back on these products are going to be detailed, marketed to adult-only environments, which is very important.
Now, around this issue with nicotine, it was just after CVA put their submission in on the specific consultations. Now, last year, just to kind of clear up for people, if I can, because it's a little difficult, but so the vaping epidemic hit in fall of 2018. It raised the alarm, government researchers and health groups by December, and the media. That's when CBC in the first week of December of 2018 did a major piece. And they had mentioned actually that Dr. David Hammond's study at that time had already been used by government to help, drive some of their movement forward. And so there was definitely, before the end of the year in 2018, there was major movement going on. Now, by later January, that's when Health Canada actually issued a consultation with regard to the advertising and promotion and how changes could be made to that in order to affect youth use. There was labeling requirements and so forth that seemed to be a separate track. And then we went to Ottawa to interview Director General Van Loon, And it was literally the next day they were releasing their next consultation paper, which was on reducing youth appeal and access to vaping products. We'll talk a little bit more about that one in a second. So when it comes to just the advertising and promotions one, what would you say is the hardest thing, if there is, for something in there for the industry to accept?
But I think the hardest thing we'll really to look at is age gating or age verifying when it comes to online websites. At the point of entry will be a challenge simply because, if we have to look at software, that we have to identify the software that's being involved, and if we have to look at that, would age gating at the point of purchase be sufficient, right? Because if we look at the cannabis and alcohol industry, the LCBO doesn't age gate at the point of entry to the website, right? Kids can open up a computer or their phone or get access and type in the website, and they'll be able to be exposed to, any type of alcohol or cannabis products in the marketplace. And I think, age gating at the point of access and purchase should be sufficient. I think the government's put in place enough regulation that we have to comply, right? So we have to look at advertising and marketing. You can't use cartoon characters, animals. That's all being restricted. Not only that, but there's new health warnings that needs to go up on those websites, they're quite prominent. I mean, I think more than 1/3 of the page would have to have the health warning. So I think the government has put forward some of the health warnings and requirements, and I think the message is going to be made very clear. But when it comes to age gating at the point of entry of a website, that becomes quite challenging, right? And not only that, I think if the alcohol and cannabis industry is not required to do that, then why is it fair that the vape industry has to implement such measures, right? So I think that's going to be the most challenging aspect of it, given that we already have very restrictive regulations, right? If we go back to the TVPA, we can't, we see it in the media a lot. They talk about cotton candy, different flavors appealing to kids, and many public health groups and organizations don't understand that we can't name. There's naming conventions that we have to abide by based on regulation. We can't call the product cotton candy. We can't call it bubble gum, right? They have different names that a young person wouldn't really recognize, right? And the only way for anyone or an adult to recognize them is when they go into a vape shop and they get detail. They can then ask, what is that flavor, right? So I think we have to understand the government, Health Canada has put a lot of regulation, right? If we look at Schedule 3, look at Schedule 2, there's already measures in place to prohibit naming conventions that would be appealing to kids, right? So we look at confectionery, desserts, cannabis, soft drink, energy drink. That's all in the regulation. So the government's already put a lot of restrictions in place, and the industry's really followed that, right? We can't look at, the industry in the United States. They don't have as robust regulations than we have here in Canada. So a lot of the things that we hear from the media and from public health groups is completely false, right? We have to understand that the government has put a lot of regulatory requirements in place, and the industry has cooperated and comply with that, right? So we are trying to work with the government, do the best we can to limit that exposure, and that needs to be recognized.
So, yeah, it's tough. I mean, it seems that one thing gets handled and then it's the next thing, and then it kind of circles around and comes back. I mean, so much got handled in the TVPA. It's unfortunate that, more layers have to get piled on, but the environment has changed. So overall, would you say that it was a detriment to the Canadian vaping industry to have big tobacco move in? Because I know a lot of our viewers believe that.
Brett, it's quite interesting. I think if we look at the history of some of the actions by tobacco companies and what they've done, and of course they saw it as an opportunity to enter the market, and of course make them available in more than 20,000 outlets across the country. But I think the most important thing is these products should always be in the adult-only environment. That was the beginning how the products were sold. And now we have a problem where, there's tremendous youth uptake here in Canada, and now we're going backwards to try to solve a problem that was created by them, right? So I think that's really important, right? If we look at the advertising promotion regulation, we saw big tobacco companies advertise everywhere, right? That is a major issue, right? Not only at gas pumps when you pump your gas, we've seen it in hockey rinks, public places, all over the place, right? And I think there's a question that we need to ask them is, why couldn't they cooperate and not to put that exposure out there, right? Because I think when we look at harm reduction, there's no doubt that we do want to, when you talk about relative risk between smoking and vaping, we do want adult smokers to know and have that information. And we want to be able to provide that in an appropriate way in accordance with government regulations. But it's clearly that the big tobacco companies took advantage of the advertising, I guess you can say that open window before the regulations were put in place. And it really did hurt the vape industry a lot. There's no doubt about that. If we look at the vape industry, no one that we know could afford to buy TV ads or have endorsements to celebrities or concerts or put them on Hockey Night in Canada or even radio ads or billboards, right? And we try to make this a product really for adults by limiting that exposure, right? At age-restricted environments. But again, when the advertising can be seen anywhere and can be seen by young persons right beside the gums and candies, now we've got a major problem, right? Now that we have to deal with.
Yeah, and you're mentioning that the industry, being what it is, grassroots industry, it's not big tobacco, that's for sure. And you don't have the big money to spend on advertising, and yet you did have to spend relatively big money to help fight the media issues that were going on. Describe that.
So it's really important, 2019, we had to spend the effort to really address not only EVOLI, the lung illness that was mainly attributed by THC, vitamin E acetate, that really caused a problem, and mainly in the United States and not so much in Canada. And, we had to put a lot of our energy just to change public perception and the misconception about vaping in general, right? So vaping nicotine e-liquid is very different than vaping cannabis oil, and we have to differentiate that. And I think, the industry's been spending a lot of effort to clarify that, right? It's unfortunate that we, in some cases, we still see vaping being lumped together with vaping cannabis products. And if it's what I should address to a lot of people is when we brought this up to Health Canada also addressed that vaping cannabis oil is not vaping, right? Under the Cannabis Act, it's categorized as cannabis accessories, but nowhere do we really use the terminology that vaping is vaping nicotine e-liquid is the same. And I have to really at that time when that EVOLI situation happened and we were getting a lot of negative public perception on vaping, it was really great to really see that Professor Hammond put out an editorial that really addressed not only academically, but this was also published in the British Medical Journal, that vaping, the lung illness that's been attributed that's happening in the United States was predominantly THC related, right? So nothing to do with vaping nicotine. And it's really important to address that. And, I was on a conversation on the phone call with Professor Hammond to see if he could allow me to distribute the materials to decision-making policymakers and, of course, to different levels of government.
So this is another example of somebody who's been a critic of the industry to the extent that he has, coming out and providing a bit of cover.
But absolutely, and I think when we talk about harm reduction, right, there's no doubt the relative risk between vaping and smoking. It's very clear that vaping is less harmful. There's a lot of science that we've seen over the years coming out of the UK. Public Health England's been very supportive of vaping. Vaping products are being prescribed in the UK. And of course, talk about Europe, they don't have a youth uptake issue. And there's a main reason for that, right? So, and I think, we look at the global stage of vaping, it has helped millions, not more than, probably at least more than 25 million people worldwide. And we know Europe alone has more than 15 million vapers, and there's 10 million vapers in the United States. So we know it's helping converting a lot of smokers to a less harmful alternative worldwide.
And that is true. I mean, there's no doubt there, even though there's all this bad news and with what's happening in the U.S. is certainly very concerning with the vaping bans and the PMTA and so forth. There does seem to be, though, outside of the U.S., a bit of an up movement. When we had Dr. Derek Yuck, the president of the Foundation for a Smoke-Free World, on a couple of weeks back, his attitude was one that's kind of like, the horse is out of the barn globally here. And the problem is so big, and e-cigarettes have demonstrated to be so effective that it's pretty much going to be very difficult to kind of shove that back in. Is that kind of the assessment here too as well in Canada? And maybe does Health Canada have that understanding?
Well, I think we have to understand the vaping products in general, right? We are dealing with nicotine, right? In Canada, it's a Schedule F drug, right? Of course, controlled by the government. And we have to really look at nicotine around the world, how it's being sold with vaping products, that we should anticipate government is going to move forward with regulations. To say that, vaping has gone, has grown exponentially, and it's very difficult for the government to move forward with either bans or tougher regulations. I think what we really need to see is the vape industry working with government to put in place strong regulations so we can protect not only youth, young people around the world, but to really show that this is a very effective tool that can work. But we need to put some rules in place on how it can be sold and how it can be marketed. And I think if we look at globally, I mean, the European Union is a great example of that. They've done that. Not only do they have they have manufacturing regulations in place, right? They have consumer product safety regulations in place. And not only that, but some of the restrictions that they put on vaping products has also shown to be, there isn't really tremendous youth uptake in Europe, right? Given that they do have 15 million vapers, not more than 15 million vapers in Europe. But they don't have the youth uptake because the government's put in place some regulation that was really more intended for poison ingestion for people, for young children. But that also turned out to be a solution when it comes to nicotine addiction by young people. We didn't really see an uptake on that in Europe. And a lot has to do with the limit that they've set forward. And when we talk about nicotine concentration levels, right, there isn't a lot of data, but the only data we can really bring from that is really what's available in Europe, right? I mean, Europe's the only continent that's regulated with the nicotine cap, right? So that's the only data that we can draw from, right? There isn't really any other country that has the data to support that or has restrictions on nicotine levels.
And so that brings up the issue with regards to the nicotine cap, because that's something the CVA kind of got behind on their own to really kind of drive the bus on that, if I'm not mistaken. And there seems to be obviously some pickup on that. BC, the health minister here, really jumped on board on the 20 milligram per milliliter cap. That's the cap that's in Europe, and that tends to be talked about as one of the reasons why the youth have not picked it up, because nicotine is so addictive. So talk to us a little bit about this nicotine cap and reassure people on how it may or may not change the way they vape.
Well, Brett, I think it's really important, when the CV came out with their position when it comes to nicotine concentration level, we just didn't pick a number. There's no doubt, heavy smokers, they may require more nicotine or maybe technology that could deliver the nicotine satisfaction that they require. But I think it's really important to address that we had to look where the data was, right? So we couldn't say, pick a number out of the hat and say, hey, someone that smoked 2-3 packs a day, they were going to need potentially, more nicotine. We don't have the data to really support that. But we can only draft from the data that's available out there, right? And that data is really what's available in the European Union, right? There's no regulations or nicotine restrictions in the United States that we can look at. So the data, the number that we supported was really based on data driven. That's made available, right? So when we do present to government, we have to understand we can't just present them any number. It has to be factual based. And that's how we presented it.
And getting ahead of the issue, though, must have been part of the determination on your part, because the government didn't say, come up with a cap or suggest a number, as you said, right? So.
No, you're right, Brett. So when the government also relies a lot on data, right? So what we do know is the government will look at the European Union. And the regulations there and how it's affect, youth in general. And they'll look at other countries as well, which, in the United States as well, and what the issues there. Of course, there's a tremendous amount of young persons vaping in the United States. And those data draws a comparison and provides information to the government how to make policy. So I think, there isn't really a lot of countries that are fully regulated. So there isn't a lot of information for us to get out there, but those are the information that we can rely on that's being put forward to us, right? So the industry is still relatively young,
right?
So not
a
lot of countries are regulated.
No doubt. And I mean, look, there's a lot of seeding that's been going on. When you're looking at some of Hammond's research and others, and you're listening to Cunningham and others, they always mention, Europe, and they do kind of hold out that, look, well, things are not going so bad there. So the more that the opposition, if for the lack of a better term, are pointing to the Europe as an example of a good path to go where youth aren't, picking up vaping in any strong numbers, I can totally see why, you look at the nicotine issue and come up with that. You mentioned that there's innovation too that can happen still in this area. So there might be, a happy medium.
That's right, Brett. If we look at our industry, we've been quite innovative. I mean, in the early years, if we go back to 2009, cigarettes or, cigarettes are an e-cigarette that looks like a cigarette, was very ineffective when it came to delivering nicotine. And as we look at, that's where the evolution of the Ego style pen came. It delivered nicotine more effectively. And of course, it wasn't the most palatable. I mean, some people find the nicotine was quite harsh in how it's delivered, but those that had a will to quit smoking really gave it a chance. And there's hundreds of thousands of those Canadians out there, that really stuck with it and had the will to quit smoking cigarettes. And those people stuck with the vape pens, and then eventually graduated to mods. That would deliver nicotine more effectively. But not only that, but it will also deliver the e-liquids would be a lot more palatable. The flavors would taste better. And it was really easy for them to kind of transition to that, because we know a lot of the smokers that were looking to quit and switch, they would always start off with tobacco flavors, no doubt about that. But once they discovered that there were better flavors out there than tobacco, because frankly, not everyone wants to smoke an ashtray flavor, they do find a flavor that they like. And once they do that, they successfully transition. They don't go back to smoking cigarettes. And I think one of the key things, I like to talk about, of course, is the consultation that Health Canada put out in regards to the results. The government did acknowledge, right, 23,000, postcards were well received, right? And more than 2/3 of those people vaped fruits to help them quit smoking.
Let me just make sure we catch this up for our viewers. There was a call out to vapors in Canada by the VAO, and that was to mail in these postcards, and they literally got there. Like, they made a difference. And that was Maria and the group there at VAO. Just, give us a little bit more around that, because I think it's a real big story to highlight.
Absolutely. So VAO, basically created this campaign. A really great job Maria did, and it's really important. She really rallied the industry at that time to get the vape shops involved, because how will we be able to reach the vapors directly? Is really to have the efforts of all the vape shops, and have to commend all the vape shops for putting a tremendous effort to getting their customers to let the government know how important flavors was to them, right? To transition them out of the smoking cigarettes. And I think it really seeing that on the consultation summary was really important, because it did show that flavors played an important role of transitioning a lot of smokers to vaping. And not only that, if we look at tobacco flavors, and going back to Nova Scotia, the complete ban on flavors except for tobacco. The province of Nova Scotia have to really understand only 6% of vapors out of that postcard campaign, and it reflects nationally too. There's data that we can prove that only 6% of vapors use tobacco flavors. So there's 94% of them that don't. It shows you that flavors do play an important role. And I think in that consultation paper, they also outlined 9% of the users use mint and menthol, right? So, we have to understand that more than 80% of vapors use flavors outside of those two categories, right? So it's important to address that, because we need public health groups to understand that flavors do play an important role. But the most important thing is, how do we restrict how some of these products should be sold, right? And I think if we look at Ontario government, they've done exactly that, right? Control how flavors are being sold and can be accessed, and also nicotine concentration level, right?
It's a fine balance. One of the other balances, and this is the last, I think, of this specific on the federal stuff, and then I want to jump into Nova Scotia, talk a bit about British Columbia and so forth, and some higher levels with regards to health statements, relative risk, and so forth. This is the nitty gritty here. So as well as these restrictions that have come down on advertising and promotion, there was also a Gazette release that was all on the labeling. And you guys at CVA, trying to address some of these issues, jumped in with a guidance document. And so I'm just going to show it, a little bit of it, while you're talking and describing what we're seeing here. But this is some highly technical stuff, and just in terms of what you have to communicate on labels. And I'm just amazed about how you could even squish all this in. And I guess in one point here that I'm showing is one of the tags that could potentially be used to do that, which has also been somewhat controversial just in terms of implementation. So fill us in on this, please.
So Brett, this goes back to in December when the CVA met with Health Canada. We have our quarterly scheduled meetings, and the regulations at that time, this was already Gazette 2. And one of the concerns that we addressed to the government was seeking that guidance document that we really needed to guide the industry. Because if we look at the regulations, there's a lot of legal language. There's a lot of I would say probably there was a lot of no clarity in regards to how the labelings and packaging should look like. What we really needed to do was we made a commitment to the government that we would get the industry compliant, right? So this was during the time where there were 80,000 product seizures, right? And we did meet with the Director General of the Enforcement Program, and some of the concerns was this took a lot of tremendous resources from the government to not only go and inspect, but to of course seize 80,000 products. What is the industry going to do, and what is the CVA going to do to address that? Because the government wants to see us not only rally the industry, but to really get the industry to be fully compliant. So what we end up doing was really, the CVA was we of course went through the regulations, identified the requirements that the government wanted us to comply with. Toxicity information, health warning message, nicotine concentration level. So what we end up doing was really gathering all that information and really made it available to the entire industry to say, every manufacturer is going to do their labels differently, but these are the requirements that are set out. So these templates weren't really to tell the whole industry to follow them, but really to guide them, how the information could be laid out and what the requirements are, what the font size, height size, all those type of requirements and how they would look like on the label itself. So it was really important for us to do that because, we want to make sure that we're part of the commitment to bring the industry to be fully compliant. And we do not want to see 80,000 product seizures. And one of the things that I brought up was, we don't get a guidance document from Health Canada. And I told Health Canada this was that we're going to probably see 1 million products that are not going to be compliant because the industry is confused. There's different interpretations out there. If we don't get some clarity, there's a high chance that we're going to get a lot of non-compliant. And it's not because we don't want to be compliant. We do, but we need a lot more clarity, right?
And you're not getting it. They don't have the resources, really, is apparently what Health Canada said, right? They just are unable to provide guidance on all the different manifestations of the regulations.
Yeah. So what we end up doing was we created this guidance document, made available to the entire industry. At the same time, we did send a copy to Health Canada as well, right, just to let them know what we've been doing as CVA to bring the industry to compliant. Right, we also even gave them bottles, right, samples to look at to show our commitment that we want to be part of the solution when it comes to compliance, that they can rely on the industry to do their best to fully comply.
Would you say that, is it fair to say that to some extent, regardless of it's on purpose or as part of the plan, or if it's a matter of resources being one of them, but in the end, is the government not relying on the industry to do a bit of self-regulation here, even though it's not the typical self-regulatory model?
Absolutely. It's really important that, and we have been self-regulating since the industry started, right? So there were, a number of retail vape shops and organizations that were self-regulating, whether it's creating some sort of manufacturing standards at the time when there was no regulations, to really making sure youth don't have access to these products. We are trying to show the government that we're being responsible. A lot of the onus has to be put to the industry. And as CVA, we represent not only retail vape shops, but manufacturers. It is the government's put in. It is our responsibility to get the industry to comply. And simply because, they're not talking to anyone else but the CVA, and we do have quarterly scheduled meetings. So there's a lot of pressure to be part of that. So that's why it's really important for us to not only provide our regulatory review to the industry, but to make sure everyone's on the right track, right? So I think what we really want to show the government that, we know the industry is being regulated. We want to be responsible, right? And we're going to do our best to comply. And I think, one of the key things, Brent, was, I think yesterday, the guidance document or guidelines came out from Health Canada to address the vaping products labeling packaging regulations. And that was something that, for a long time, we've been asking for guidance document, and we were never really given any guidance document. And it's really great effort on Health Canada's part to really listen to us, because every meeting that we do have, we always talk about guidance and having some sort of guidelines. And I think, the government's starting to realize that, hey, let's make sure we guide them in the right track, so we can get the industry to be compliant. Because I think one of the things that we've seen, Brent, is when the government did post their product seizures, 80,000 product seizures, it was also made public. But also a lot of health groups, public health groups, anti-vaping groups, whatever you want to call it, really took advantage of labeling the industry as well, they're not compliant, they can't be trusted. And that's a major concern for us as CVA. We definitely don't want the entire vape industry to be seen as that, especially, many of the people in the industry are working very hard to be compliant. And being the great gatekeepers that they are for this industry. So it's really important for us to do our best efforts and not to really give them any position to attack us on that front. And it's interesting because, Daryl and myself did have a meeting to address the product seizures with Health Canada. And we did make a commitment that we are going to bring the industry to be more compliant, but we also need the government's cooperation.
Would you say that Health Canada has lost some of the trust they might have had for the industry?
Sorry, Brett, in regards to?
In regards to the enforcement and, the seizures and so forth, there was quite a beating. That came at the worst possible time with regards to everything else that was going on. So I'm just curious to know whether or not, has there been some damage done, do you think? I mean, I would think obviously there has been. I mean, certainly even just from a harm reduction point of view, more Canadians believe that vaping is worse than smoking. I mean, it's really gotten bad out there. So I'd imagine that there must be some trust issues that you're having to deal with.
Brett, I don't, we have to look at, we've gone through a number of director generals over the past, a couple of years. I think we've gone through 3 of them, right? So I think we have to understand is that I don't think there's a trust issue. We've been quite honest with Health Canada. I think the issue is really driven by youth uptake, right, as their top priority to address that. And the reason why I say this is because, Health Canada has acknowledged when it comes to compliance, the work that we've been doing in terms of bilingual packaging compliance, even look at Gazette 2, right, what we're trying to do to create this document to really get the industry to be fully compliant. They do see the effort that's being put involved, right? Our meetings aren't about just talking about certain topics and discussion. It's every time we do have our meetings, we present them some of our policy recommendations and solutions on how we would deal with it, right? So even with the age verification, we presented them the type of software, what type of softwares we could use, how it would work. So we did actually, take action and really put it to heart on how we can offer some of those solutions to the government. We just really need them to mandate it and put it into regulation to put in place. But we are showing our efforts, and I think it's really important that we want, since day one, the CVA has always been, we want equitable and sensible regulation for this industry. And the only way for us to achieve that is to really show the government that we are address some of the issues that we know they're concerned of. And this not only goes across federally, but even to provincial governments.
Exactly. So, and I do want to get to provincial governments in a second here. Let's just I want to go back to your document and the labeling here. And this is an example, just some information around health warnings. And that's really the key thing. And that's what we said in our lead here today, is that the health warnings are really the big change. They want the health warnings on any advertising so advertising such that it is, that's still available to be used by the industry, must have the health warnings. The health warnings need to be on all of the packaging and so forth. And here's just an example from your guidance document with regards to that. And, nicotine is highly addictive. Fair enough. Stuff that says that it's toxic. I mean, yeah, you can't argue with chemistry and so forth. However, it's not the harm reduction argument. And when we go back to, that's my Alberta. So here's a slide that's taken out of the TVPA. So this is actually out of the law. Vaping products, the purpose of this act with respect to vaping products is to support the objectives set out in subsection 1, to prevent vaping products youth use is what I say all the time, product use from leading to the use of tobacco products by young persons and non-users of tobacco products. So to protect young persons and non-users of tobacco products from inducements to use vaping products, to protect the health of young persons and non-users of tobacco products from exposure to and dependence on nicotine that could result from the use of vaping products, to protect the health of young persons by restricting access to vaping products. So this is in what's already in law, to prevent the public from being deceived or misled with respect to the health hazards of using vaping products, and to enhance public awareness of those hazards. So this is, and we reported this from the moment that the originating legislation, which was Bill S5, was tabled in the fall of 2016, right up in like Section 1, vaping is a health hazard. And once you enshrine vaping as a health hazard, there's no room for harm reduction. So the industry, we argue harm reduction, we try to make that point. Health Canada might acquiesce, to that. But in the end, the law says it's a health hazard. The law says the entire goal of the law is to make sure the public is aware of those hazards. So where does the room come in here for vaping to, communicate to smokers that this is a viable option for them?
So, Brent, I think we go back to looking at the Tobacco Vaping Products Act. The government put forward two pathways. One, of course, is a consumer product, and the other pathway is a therapeutic product. We look at, there's no doubt, right, the long-term effects of vaping is unknown, but there are ways to understand, and there's testing and emissions and toxicology that can put forward to really identify whether, specific types of, we'll just say e-liquid in general, is toxic or non-toxic, right? If we look at the European Union, they do have those regulations in place. They not only have emissions, but toxicology is a mandatory requirement. And that actually is the science aspect of identifying whether a liquid is toxic or not. I think one of the key things is manufacturing regulations have yet to come. And there's no doubt that there's more regulations coming for the vape industry, and manufacturing regulations will address that. Not only GMP and manufacturing standards, but also emissions and toxicology, right? And I think, again, we're still at the very early stages of being regulated until full regulations are put in place. And I believe, when it comes to the health hazard side of it, I mean, this will really eventually, somewhere down the road, once we do have those manufacturing regulations, that will address whether your product is I think the most important thing is the government is concerned about consumer safety. So everything that they do is all evolve around ensuring that whether it's a vaping device or a vaping liquid, that the product is safe for consumers to use, right? So I think we are going to see those type of regulations come out eventually. And when they do come out, there is that pathway to, again, I keep talking about therapeutic pathway, there is that pathway to make those health claims, right? So it's not like the government didn't put that made available, but again, I think the science and those that do take that path will eventually be able to do that.
And indeed, right before the vaping related, I believe before the vaping epidemic popped out, Health Canada had sent out a feeler. It had gone up on their website for feedback, and organizations such as yourself and other organizations, including those that are not pro-vaping, responded. And what this was Health Canada, and this was an extension, after TVPA was put in place. This is also impacted by, things that the industry had been asking for. What can we say that can communicate some form of benefit to smokers? Because if we all agree that if smokers can transition, that they're better off for their health, Health Canada understood that. And then, of course, they had their science advisory panel, which, of course, many of those members have been on RegWatch many times. And they were providing Health Canada the advice and counsel that we need to have statements. The industry should have pre-approved statements that they can utilize inside their marketing. And kind of the trade-off being, we can restrict access. We can do a whole bunch of things. We can accept, advertising and promotion to be restricted, but yet we still have to have a pathway to be able to talk to the smoker. And so it appeared that Health Canada had been getting that. They had put out a document. Now I've got this in Word because, of course, it doesn't exist anymore on the website. It was October 5th is when I put this together. I was probably around the date that they had released this. And Health Canada's proposed list of statements for use in the promotion of vaping products. These are some of the ideas that they kicked around. If you're a smoker, switching completely to vaping is a much less harmful option. I mean, that sounds pretty common sense. While vaping products emit toxic substances, the amount is significantly lower than in tobacco smoke, and so forth. The chemicals are much lower. Completely replacing your cigarette with a vaping product will significantly reduce your exposure to numerous toxic and cancer-causing substances. Switching completely from smoking to e-cigarettes will reduce harms to your health. Completely replacing your cigarette with an e-cigarette will reduce harms to your health. So these, got a lot of people very excited that there might be an opportunity to actually be able to communicate what is considered in some places scientific fact, without, running afoul of the TVPA. So what's CVA's thoughts on this? I know that in your press releases with regards to the advertising and promotions regulations that came down last week, one of the key things you did single out is like, hey, where are these health statements? So what is your thinking on this? And do we know anything about, are these completely off the table?
Brett, so it's quite interesting we talked about the relative risk statements because, when I was government relations chair, those relative risk statements were presented to us by James Van Loon at Health Canada and asked us what we thought about those statements. And, we thought they were, of course, great, right? It was a very major step for us to take the opportunity to talk to smokers that there's a less harmful alternative with these relative risk statements. So one of the issues, of course, is there were a number of them, as we can see, and as far as I know, they've been narrowed down to a few only. The relative risk statements are still there, but one of the issues is that we have to address youth uptake, right? And that's hence, CVA put out a release to talk about the relative risk statements. Now that advertising and promotions are restricted to adult-only environments or adult-only places, give us the relative risk statements that we can then talk to adult smokers or looking to transition. Because we have to look at the lung illness. EVALI has made a major impact to change perception of vaping. And we've seen many vapers have gone back to smoking cigarettes during that time, last year, starting September, right? And the industry has been seeing a major decline in sales, right? So we look at if there's a major decline in sales during EVALI, where are those people, what are they going back to if they're not vaping, right? So it's a major concern. It really took almost, 3-4 months afterwards for people to realize that it wasn't attributed, EVALI wasn't attributed by vaping nicotine liquids, it was attributed by vaping THC. That was, of course, laced with vitamin E acetate as being the problem. Now we really need to talk to those because there's still 5 million smokers out there, Brent. 45,000 Canadians die each year from smoking-related diseases. That is 1 in 5 deaths in this country. That is a major problem. And we have to have the ability to talk to those smokers so that they know that there's a less harmful alternative out there for them, right? And those are willing to have the will to make a commitment to quit smoking. We want to be able to detail them in an adult-only setting, right? Which makes 100% sense.
When we talk about advertising that the industry would still be allowed to do, I mean, it seems to me that the perfect example would be, washroom at a bar, right? Guys or girls washroom either way, and be able to communicate there. So so those ads should be allowed. So the question is, what do you actually communicate? Because there's so much constraints around communicating any kind of relative risk or health benefits. You can't do any brand advertising, in any, well, you can do, but it can't be lifestyle. I mean, it's just like every step you go, this whole thing just seems to be a constraint on the industry's ability to communicate, which presents a problem too, because once, when these media, hailstorms hit on issues, there's been no prepping, building, awareness and so forth with the marketplace. And so it really leaves the industry vulnerable.
And Brett, that's right. I think the most important thing is we have a number of conversations with Health Canada, and what's been really put priority. We talk about harm reduction, and being very important to a lot of Canadians, especially Canadian smokers. But the government has a top priority in dealing with the youth uptake issue, right? That is the number one priority, and harm reduction, will follow that once we address the youth uptake.
So, Sam, they've really put the onus on the industry then to solve this issue to some degree, right?
Absolutely, because I think the most important thing is the industry. Of course, there's a lot of controls, right? The government's giving us a pathway. We just, of course, have to comply. But not only that, but being the gatekeepers and policing. If there's any illegal activity or type of infraction, the government expects us to report that. CVA is expected to report that to Health Canada, and we are basically being the gatekeepers and police of this industry, and that is communicated to us by government.
How does that go over sometimes with the community?
Not easy. I don't expect everyone to understand the pressure that's been put onto us. But generally, we are trying to do our best to fight for this industry. And there's tremendous pressure, right? And we're trying to do our best to even guide everyone to be fully compliant. I think a lot of people in the industry have seen some major changes from the CVA as we work very hard to not only work with government to ensure that we have sensible, equitable regulation, but the most important thing is the future pathway for this industry. We still have, we see ourselves as being an important role when it comes to converting a lot of smokers that are still out there. And I guess, we have to tell the industry, as tough as the regulations come at us, we have to stay strong, do our best to comply. And there's going to be, of course, the industry is really here to stay, and we have to really work with government to achieve that, right? So I think, we've been having a lot of flexibility for many years, Brett, but we have to understand now the government's kind of taking back some of that control. And it's really important for us to work with them, to do our best to contribute to minimizing and weakening some of the issues that we have when it comes to kids vaping, right? So we do want to contribute and do our best to help the government and restrict access. And again, going back to, this product was intended for adults, and we intend to make sure that the adults have access to these products safely, but at the same time restrict them being viewed by young people, right?
Right.
So the industry is willing to comply with that, and our submissions have always addressed that, right? We're willing to work with the government to restrict exposure of these products to adult-only environments only.
Well, and that is kind of the key thing. That's the win there is really kind of reminding everybody that this industry was built, grassroots up, small businesses, still a lot of small businesses that are involved, and probably the majority still being the case. And then, of course, you've got some real businesses that are employing a lot of people in manufacturing and distribution and so forth. And then, of course, you've got big tobacco that's involved. But, to remind everybody that this is something that has been built through adversity, probably almost for most of the time, except for maybe in the early couple of years when we weren't on the radar. And I think that, from what we've seen at RegWatch and what's going on worldwide, to have gotten through COVID in Canada, and I think in what potentially could come out in the next 6 to 8 months in terms of dealing with the regulations, dealing with, hopefully seeing a reduction in youth use, it being clear to the public that the industry is not preying on youth. I think if those things can get handled, there's a real shot that, the industry could flourish.
Absolutely, Brett. I think, we have to understand dealing with youth uptake isn't going to be a quick process. It's going to take some time. And one of the things that we really need, not only reaching out to public health groups out there, is that we really need time to address this, right? It isn't something we could snap our fingers and and do, it's going to really require implementing the age verification at the point of checkout, restricting all the advertising where these products can't be seen. And really, when we talk about, we talk to the government about, reviewing the regulations every 2 years to see where we're at. Once we put in place these regulations, we really need time to see how it makes an impact to the industry. Not only that, how do we contribute in minimizing youth uptake? And we really need that time to see that once these regulations are in place. So that's one of the things that we really wanted to put forward to the government, is to give us time to address this, right? And we are going to do our part to contribute.
That's the time that the industry did not have from May 20. It should have been in 2020. There should have been 2 years of nice calm, implementing the regulations from the TVPA, working with government on that. It's been anything but calm. We've got a couple more questions left, about 10 minutes. And just before we do that, I want to remind everybody that, of course, regulatorwatch.com, we cover this industry immensely. It's our 5th year anniversary covering vaping coming up this fall. So we've been dedicated to this project. And of course, we promote fact-based science. And it's crazy that we have to call out that, because shouldn't all science be fact-based? But yet we do have to point that out. Encountering misperceptions is big for us. Destigmatizing nicotine. And, just from a sheer journalistic point of view, it just begs for a media outlet to be out there and talk truth about nicotine. And so that we definitely are trying to do that, and of course hold researchers, regulators, and reporters to account. And we've got great people that have been supporting us, of course, fans that do that. And then, of course, we've got some great companies that have done that too as well. And you can just go to Who Supports Regulator Watch, and you can see Demand Vaping, obviously without John Glauser and Demand. Our people here in Canada that have been keeping us going: Divine, Flavor Art, Stinky Canuck, Flavor Crafters, and Vape Nation. Those guys are keeping our Canadian coverage going. And please, if you do get a chance to give them a shout out, either a hi or purchase some product, please do, because they are responsible for our Canadian coverage. And so back after we get out of the sale, I hate that part. I really, really do, as you know, Sam. So let's jump into off the federal stuff, and let's get into some Nova Scotia. Now, I'm going to go to our great friends over at Planet Vapes here for this one. And Canadian province Nova Scotia has published a ridiculous list of prohibitions on vaping products, criminalizing most vapors in the process. It was celebrated in the media by calls for legislators to go even further. So, these guys are really good, at Planet of the Vape. So I have not independently fully checked every single word here, but we're going after on this. So you correct me if I'm wrong here, Sam. But this is the incredible list of the Revenue Act and Revenue Act regulations. So this is prohibitions on vaping products. And so I guess this was as of last fall, was it? September 15th, Sam?
That's correct, Brent.
Okay, so let me just jump in. Thank you for being my verifier there. No person shall be in possession of a vaping product on which tax has not been paid, or not purchased from a retail vendor who holds a valid permit. Got it. The stuff that really gets crazy is no person shall transport a vaping product unless at the time of transport, that person is in possession of a bill of lading, waybill, or other documents showing the origin and destination of the vaping products. So, and then of course you can't have more than 240 milliliters or 5 devices. Otherwise you're dealing. Obviously this is like, show me your papers.
Yeah, I'll have to say Nova Scotia has the most restrictive regulations in the entire country, and one that obviously does not put, in terms of harm reduction as a priority. I mean, if we look at the flavor ban as a really good example, there are, tens of thousands, if not more than that, Nova Scotians that rely on flavors to kick their bad to not smoke cigarettes, and taking that away from them, the government hasn't really addressed the issue, right? Again, looking back at Ontario being the regulation that we want most provinces to follow, is that we can't forget about the adult smokers and the vapors out there. Provide them access is really important, right? We understand dealing with youth uptake and youth vaping rates issue is a major issue. But there's no point for closing the doors, right? And I think we have to look at, there are a number of provinces that actually met with the industry, that has met with CBA, that really listened to some of our recommendations and put in place those recommendations to give them that control of how they're going to control enforcement. And that's really, it's very sad because, you know, we've been calling on the government in Nova Scotia to meet with us to hear some of the recommendations that we do have for them. But, you know, it's unfortunate that we never had the ability or the opportunity to meet with the government. But now we've got probably the most restrictive regulation in the entire world.
I know.
And that's a problem, right? We're driving people back to smoking cigarettes, right? And when we even talk about taxation, you know, there's no point to tax the industry when, you know, the tax, first of all, doesn't make sense, right? 50 cents per milliliter, you know, it makes a bottle of e-liquid more expensive than buying a pack of cigarettes. So you're not really encouraging harm reduction there, right? So, you know, realistically, when it comes to taxation shouldn't be focused on milliliter, right? You know, and there's a lot of policy and regulations put in place in Nova Scotia that doesn't really benefit harm reduction in adult vapors, right?
Well, it sounds like they don't really accept the argument of harm reduction. I mean, they've gone so far with those regulations.
Absolutely, right. And we have to look at the impact to the industry, right? There's a large number of vape shops that have already closed in Nova Scotia, right? And you know, there's going to be even more, right? And we have to, and I think one of the troubling matter is, you know, the Nova Scotian government didn't recognize, even the federal government being put out there, that, you know, only 6% of the, based on the survey, use tobacco flavor, right? So, I mean, this will give you a great indication that majority of Nova Scotians, only 6% of them are probably using tobacco flavors, right? So by banning flavors, you're really leaving them with no option, right? And this also fuels the black market, right? So now you've got a major problem. You've not only destroyed all the local retailers in Nova Scotia, but you're fueling people from the black market to create products and sell them illegally, right? And that's a major problem because we don't know the product's safe. But not only that, but now you have, again, what I talked about earlier about online sales. Now, those users are going to buy their products elsewhere, wherever they can order from. So the government hasn't really solved the problem, right? When it comes to youth uptake.
Sure.
Right.
When it comes to Nova Scotia, and last question on this, because I want to quickly jump into Quebec and Alberta and BC, and then I'll let you go. So thank you for your time too, by the way. And to our audience, this is definitely going to be one of our longer pieces. When it comes to Nova Scotia, do you think the opponents of vaping nationally, so your Canadian Cancer Society, Heart, Lung, so forth, do you think that the opponents to vaping look to Nova Scotia as an example of what they would like to see for the entire country?
Well, you know, I think what's really interesting is many of them, of course, would like more restrictive measures, you know, when it comes to regulations to the industry. But a lot of them are forgetting the harm reduction opportunity that vaping provides. And to be frank, I think a lot of these groups are not familiar with vaping products, right? And the important factor that flavors play an important role to transition a lot of these smokers. But again, we offer a solution that makes sense, right? If we're looking to restrict exposure and access, there's no greater place than to make sure that these are available in adult-only environments, right? So we look at Ontario, right, and even other provinces where there's a licensing regime, right, where the government can mandate a license, a specialty vape shop license, that provides control to the government and who's selling the products, and very limit that a lot of these products are going to be accessible at an adult-only environment where only adults can go in, right? By completely banning that outright, you know, isn't really the right solution. And I think, you know, we're forgetting the government's mandate is and all different levels of government is trying to achieve less than 5% by 2035. And we can't deny that vaping plays an important role when it comes to achieving that, right? Less than 5% smoker by 2035. And by completely not understanding the role flavor plays, because the government has put a lot of restrictions on how we can create labels, market the products, right? So the industry is complying. We're on that pathway. Completely banning is going the total opposite way, and it's really important for these public health groups to understand that, right? There are other measures we can put in place to control how the products are sold, right? Restricting advertising, restricting point of sales, restricting online sales, putting measures in place, asking the CBSA to put their borders back up, right? Making it very difficult for young persons to obtain the product. Those are things that we can easily do. And I think that's moving more towards the right direction.
What can you,
again,
please?
Sorry.
I was just gonna transition us to Quebec. What can you tell us about Quebec?
Well, I think what Quebec is, as many of you know, vaping products are regulated as tobacco products there. So there's a lot of restrictions in the way how vaping products can be communicated, even at the vape shop level, right? There isn't any exemptions for vape shops, right? They have to hide their products. They can't advertise. And hence that's why, we had the constitutional challenge for a number of years now. And quite frankly, one of the very few constitutional challenge that's won for vaping. And it's really important to address that. Quebec, our hopes really is we do know the province is looking to put forward a regulatory framework when it comes to addressing youth uptake. What I really want to address to the government is that let's not forget about the harm reduction opportunity that vaping can provide. And let's not forget that these restrictions, can be controlled, right? And let's look to the vape shops because they are already, Quebec is one of the provinces that has the most regulation, very restrictive. But again, this can also be controlled by the government through specialty vape shops, right? And the industry is more than willing to comply. And really, we need to ensure that the government acknowledges that. Right, that vaping has converted, at least 1 million smokers in Canada, and many more worldwide. So it's really important that we look towards other provinces that are doing the right thing, like Ontario, really restricting how these products are sold. Right?
So
and that's how we're going to add control.
Sure, and let's look at BC because there's a province that they had this big 10-point plan that they had come out with. Some of it had some problems. One of them being the largest size of e-juice would be like 10 mils. And, crazy. And then obviously they have a NIC cap proposed and, pulling stuff out of C-stores and so forth. But it seems to me that what I've heard from you and Daryl over the last 4 or 5 months has been that BC looks like it might sort out to be okay. So but we're still waiting for those BC regs to drop.
That's right, Brett. We've been communicating with the government in BC. We've also addressed some of the concerns when it comes to the 2 milliliter tank capacity and the 10 mil bottle size. We addressed that was really a European Union regulation that was focused on accidental poison ingestion by young children, right, normally under the age of 5. And that doesn't really apply to Canada. And the reason behind that is, the government's put forward regulations when it comes to child-resistant containers quite frankly, those 10-point plan, some of the 10-point plan action is irrelevant, right? So when we look at plain packaging, right, we address that. Our new labeling and packaging regulations are already quite restrictive, right? So it would also defeat the purpose of the federal regulation that's being put forward if we went plain packaging, and they did acknowledge, that it makes sense, right? Because the federal regulations already we get the message, right? So
right,
the health warnings, all of that needs to be there. So we can't really have plain packaging because quite frankly, if we look at a 30 ml bottle of liquid, the health warnings and toxicity and all that information pretty much make up almost, more than half of the display panel, right? So there's really no ability to market any brand. There's very limited space left available. So we did really address some of those issues, and we are looking forward to the regulations to come out. It's been a while. I know a lot of people are expecting it to drop back in April 1st of 2020, and I think when the government's ready, they're going to acknowledge the regulations. And the most important thing is, CVA will have the opportunity to address that to the industry.
So now Alberta. And what's curious is for the longest time, for years, there was no movement out of Alberta at all. Federal regulations and other provinces coming down, there wasn't really any movement. And then all of a sudden, there is movement. And the movement in Alberta is kind of a bit disjointed too, because there's what has been proposed by the health minister, and then what is still being driven in a campaign, an unrelenting campaign against vaping from anti-vaping groups. Some of them were clearly anti-vaping groups like SAVE, and then, the regular nonprofit health organizations that, are traditionally in the space. So it seems to me that by no means is Alberta secure in any way, even though the regulations right now don't seem to be, as restrictive as they could have been.
Brent, yeah, I mean, if we look at Bill 19, the government has put forward, their legislation, and I think where the industry is really concerned is that the government has no intentions to ban flavors at the moment, but this gives them the power to have the ability to do so if they see it, if they make a decision somewhere down the road. I think where our concerns lies is there are a number of groups pressuring the government to follow suit with what Nova Scotia has done, and that is really the wrong, really wrong. That isn't really a good policy decision for any government to do. Again, we have to look at the number of Albertans that have converted to vaping from smoking cigarettes. Flavors play an important factor, and I think again, we have to look at flavors should be made available, but it should be restricted in where they can be sold. And I understand there's 50,000 plus youth vaping in Alberta. That's a major problem, and we can understand the government has tremendous pressure in dealing with the youth vaping rates there. But again, we can put restrictions in place to make it much more harder for them to get access to these products. But again, we look at the government's policy, right? They are, putting in place fines and penalties for possession of vaping products if you're underage, right? And again, some of those policies could be stronger, right? So, kids would be, I guess, they would not just be discouraged to use the product if they're being fined heavily. But not only that, we need to look at the social sale that's going on in Alberta, which is tremendous. And how do we deal with those people that are deliberately selling to minors, right? The fine should be greater, right? And how are we going to deal with those bad apples that are harming the industry, right? And again, we want to be able to work with the Albertan government to make sure we have the right policy to deal with that. But at the same time, let's not forget about the adult vapors that really need to use certain flavors to get off of cigarettes.
Yeah, it's important. I mean, when I was, reviewing, our last couple of years of coverage in the 2017 Youth Tobacco Alcohol Survey, and what the actual government had put in their consultation papers were interesting facts that we're talking. I think the number was really high. It was well over 30%. I think it's like 49, but it was really high. The percentage of youth that got their devices through social sharing. And it's hard to reconcile that because I'm just putting out an observation here, and then I'm going to throw a question at you. Pretty much our final question, I would say. And you can't really, as the industry, fall back on the fact that there's social sharing going on, because it's not where the focus needs to be. I get that the industry, CVA, is as relentlessly focusing everything on youth to the same extent that the opposition and the government and everybody else is focusing on youth, even though there is a large percentage of those of youth getting devices that are coming from friends, family, it's social sharing, but you can't really do anything about that because that's not the industry. So I can understand that. I'm just pointing that out as an observation because I think it's a bit of a sticky wicket. Let me toss this at you. Overall, so much work had been done pre-2018. So, through the early days with the HESA committee and all the, presentations to Parliament and so forth to really drive harm reduction. The government drops Bill S5. It's clear it's not harm reduction, but it's still, it was livable. It was legalizing vaping, and it was providing a national regulatory framework, which is really critical. May 2018 becomes law. Now that process of working with Health Canada, the regulator, and the industry, as you're carving out, this brand new industry, right? And that really didn't get going. Like, you got hit on the knees on that in September, October 2018. By January, it had just fallen apart. Later that year, you have the provinces starting to break away. And now you've got this hodgepodge of, Quebec, which was always bad. Then you've got Nova Scotia being really bad. You've got Alberta, being a fight there. BC's coming, and there's no uniformity. But yet that's exactly what the TVPA was supposed to do, was provide a uniform federal framework. So how did we get to this spot? And if you just say youth vaping, I'm going to have to figure out a second question. But are you disappointed in how this is full out? Does this undermine some trust from the industry's side in government to be able to come up with a regulatory framework and stick to it? How do you plan a business around regulations which are always constantly changing, in flux, and open to local, interpretation or different local regulations?
Well, Brian, I think it's really important when the TVA came out, the government did say regulations are to follow. There's many components of the regulations. You've got the, marketing, advertising, promotions, right, which includes marketing. You've got labeling, packaging, right? So we have to look at the CCPSA. There's a lot of requirements, right, when it comes to products being sold. Sure, I mean, if they came out a little bit quicker, we wouldn't have a call from different provinces of more regulations. There's still a lot more. There's manufacturing regulations that needs to come out. But again, I think the industry just really grew quickly. Going back talking about youth uptake, that really triggered a lot of the provinces to say, hey, we need more regulations. We have a problem that we need to deal with. And if the federal government isn't going to put forward tougher regulations, we're going to go do something. But I think a lot has to do with maybe communication between the province and the federal government, because there were regulations that made the product less appealing, right? There's no doubt about that. If we look at Bill S5, TVPA, there's Schedule 2, you can't use certain ingredients, right? You can't use characters, you can't use animals, you can't use any lifestyle marketing tactics. You can't name flavors based on the, confectionery desserts, energy drink, soft drink, anything that appeals to kids. The government put in place a lot of restriction, right? I think where the disconnect was, the province and the federal government, Health Canada, weren't really communicating to say, hey, these are all the measures that we put in place. It's going to be restricted. These products are not going to be as appealing as what we've seen. And I think to this day, it's interesting because when we meet with different levels of government across the provinces, a lot of them weren't really well aware 100% about the federal regulations. So only for us to go back to address that we can't call this cotton candy because, this is against the federal regulation. The industry's been complying for some time now, right? So we're not, so we don't get painted as the industry that's trying to target kids. And that's absolutely false. We haven't been doing that here in Canada. The industry and not only our members, but everyone in the industry has been doing their best to comply with regulations. But again, I'm hoping we can change that narrative to the media so they really get an idea of what we've been really doing, right? They can't just look at us as being businesses and stakeholders that only care about the profits. No, we do care. Those that have built this industry to where it is today knows that we've, in the process, they've converted a lot of smokers, right? And the solutions that the CVA really put forward to offer to the government is how we can control how these products are accessed, how these products are marketed, and we're willing to comply. And we see ourselves as true stakeholder in the industry that really wants, fair regulations and be part of the government's goal, right? A less than 5% smoking rate by 2035.
And we're not big tobacco. Relentlessly, the message, right?
Yeah, and we're not. We receive no funding from tobacco companies. And again, every policy recommendation we put forward wouldn't be something that they would agree with, right? And I think the most important thing is we believe in doing the right thing and to really control and put this access back to age-restricted channels. And again, anyone that is looking to quit smoking cigarettes, they should be detailed appropriately in a vape shop, right? And we know convenience stores don't have the ability to detail someone that smokes 2-3 packs a day, right? And we do know that, when you have something as potent as 60 milligrams per milliliter available in 20,000 outlets, if it gets in the wrong hands, we know flavors aren't addictive, nicotine is. Right, and Health Canada is well aware of the heady effect and the buzz factor. Is once you have a minor that gets a hold of something that's very potent, they're not gonna, they're a new nicotine addict, and that is a concern, right? So we're trying to do the right thing and put in place recommendations that can control and minimize youth uptake.
Well, that's great. I think that's a really good point to end on. Sam, thanks so much for coming on the show.
Right, thanks for having me. And
just stay right there. And that is it for this edition of RegWatch. Before you head off, please go over to support.regulatorwatch.com. That's support.regulatorwatch.com. And consider making a financial contribution to our vaping coverage. It's easy. Just dig into your wallet, find a few dollars, and toss them our way. You'll be happy you did, and so will we. And while online, don't forget to like us on Facebook and to follow us on Twitter. For regulatorwatch.com, I'm Brent Stafford.